Hi everyone, this is Elena Apostol.
And this is Dr. Jonas Apostol.
Welcome to Apostolified Conversations. So, for this episode, we'll be talking about overcoming dental anxiety and fear surrounding getting dental procedures. So, stay tuned and enjoy this conversation. Hello, guys! Welcome to another episode of Apostolified Conversations. So, for today's episode, this is gonna be focused on overcoming dental anxiety
Yeah.
and fears surrounding getting dental procedures. Okay, so marami sa inyo takot pumunta sa dentist. I am sure. I had fear myself before when I was still a child. And here sa clinic, every day, it's a new thing for us. Takot ako. Paano kaya? Anong gagawin? So, very anxious of what will be done on the chair, anong gagawin ng dentist sa kanila. So, Doc Jonas, let's start.
Let's start.
You've
I'm so
been-
excited.
You've been in the practice for how many years?
15 years.
15
So,
years.
3 years old pala nagpa-practice na.
Okay, so 15 years, I'm sure dental student ka pa lang. And up until now, no, you experience a lot of patients going to you with fears.
Yeah.
And here in the clinic, actually, when they come in, they always ask, hala, anong gagawin? Natatakot sila. Wala pa ngang ginagawa, natatakot na. So these patients, they really have fears, dental fears. And let me ask you, what do you think are some of the reasons why natatakot sila, why they have these fears?
Well, number one, it's pain. Okay? Lahat naman siguro takot sa pain. Okay? Pero may iba hindi din. And also, childhood experience. Yun yung mga bagay also that we have to check on. And also, like mga trauma, past experiences, doon talaga. And madami pa. Let's say, for example, yung dentistry, ginagawang pantakot sa bata. Okay? Isa yon. Kwento ng friends mo na experience nila about
So ikaw rin, parang you feel you will experience the same scary thing they
exactly.
experienced.
Exactly. So, a lot of factors associated with anxiety going to the dentist. And these are like mga common reasons.
You know that the fear of dentists, ang tawag dyan ay, meron talaga akong research dentophobia or odontophobia. And this is extreme anxiety at the thought of going to the dentist or while in the dentist's office. And actually, you're right yan ang mga reasons why patients have trauma or meron silang fear of going to the dentist. Meron pa, ito pa. It's related, sabi sa research, evidence suggests that the causes of dental fear, yan ang na-research ko, or dental phobia are related to exogenous factors such as direct learning from traumatic experiences, vicarious learning through significant others, ayan nga ang mga sinabi mo, media, minsan napanood lang sa TV, natakot na. Parang nakarelate, parang feeling na nakarelate sila. Takot sila because of what they watched on TV. Maybe. Endogenous factors such as inheritance and personality traits. Pwede rin pala yun. Kindly share nga, Doc Jonas, what do we do here in the clinic or what have you done in the past to help these scared patients na maging comfortable during the procedure or tumuloy sila sa procedure?
Well, here in our practice kasi we have a systematic approach. Like we don't go straight to the mouth. Okay? we talk to the patient, we do checkup, we do x-rays. These are procedures wherein we don't touch teeth. Hindi
Yet.
kailangan. Yet.
Aha.
Hindi kailangan may procedure. Kasi we have to build rapport also.
Okay.
Okay, that's
Trust and rapport.
trust.
Ito sa patient for you to, so we get all of these x-rays, oral history, parang ano mo na rin yan, makausap mo yung patient.
Yeah. You have to establish somehow like, relationship, like makilala ka nila na hindi ka
for
naman
them to
harsh.
feel-
So,
And for them to feel comfortable.
comfortable. Yeah. Kasi it's hard to like treat the patient if, they're not comfortable also. Yun yung usual na ginagawa natin. And sa mga takot, syempre, we have to start from very hindi masyadong invasive the procedure, such as normal cleaning. Yan, doon muna tayo mag-start. Kasi, we have to be careful sa lahat-lahat. It's not about, it's not really about the procedure itself, pero yung capacity ng patient to handle with the stress inside the clinic or sa pag-upo niya pa lang sa chair. So we have to, as a professional, we are actually mindful of these things kasi we care about the patient. Kasi anything can happen if yung pasyente is like may anxiety pala sa sa amin. So, yeah. So, kailangan medyo din kami, careful kami sa lahat.
So, first step is when the patient comes in, of course, they're feeling something. So, pumunta sila sa dentista.
Yep.
We create rapport. We make them feel comfortable in the chair. Of course, getting all these x-rays, diagnostics, para at least we can tell the patient ano yung tamang approach.
Yeah, what needs to be
What
done.
needs to be done, the actual procedure for them. And then, when you feel, as a dentist, na mafe-feel mo yan, na they're already comfortable with you, probably you can start with non-invasive procedures like cleaning, and then step by step. That's what you're saying.
Yes.
Okay, so as a dentist, for you, of course, for you, we cannot speak about other dentists. For you, step by step, hindi mo mamadaliin na, okay, may problema siya, okay, i-treat natin agad. So you are very conscious first of the patient, how the patient feels. And then step by step, we treat the patient
Yes.
patungo sa
Ideally.
concern. Ideally. I see.
Ideally, but
Okay.
there are elective cases. Let's say, for example, may cavity, may papastahan ka. We can wait ng mas matagal konti. But there are certain cases like swollen, infected.
Okay.
So we have to educate the patient na because of, medyo matagal na nagkaroon ng problem. So we have to treat the infection. So it's always case to case pa din at the end of the day. But in parang real world, or a real ideal scenario, we have to go from less invasive to invasive. Pero to combat that anxiety, mas maganda, don't go to your dentist na sobrang problematic ka na. Kasi mas madami na tayong, alam mo yun, mas madaming possible trauma na mapupunta sa'yo kasi ang dami ng problem.
If it is too late.
If it is too late, yeah.
Mhm.
So we have to, we have to be more methodical in our approach. So dapat dun tayo sa pinaka less invasive. So, yeah.
Okay. Allow me to share lang the one of my experiences when I started here joining you dito sa world of dentistry. So meron kasi one time na mom kasama niya yung kid niya. Yung kid niya super takot. I don't know if nakita mo tong patient na to. I couldn't recall anymore. Pero si kid, sobra siyang takot. Takot na takot siya. But kita na kasi ang dami niyang cavity. hilig sa sweets, yung normal bata na ice cream palagi, sweets, hindi nagtutoothbrush.
Okay.
Normal yan, di ba? So, si mother, na-bother sa kanyang anak and dinala niya yung kid sa clinic. Ah, pumunta si mommy, kinausap, what will be done, okay. Iyak nang iyak yung kid. But because the mother really wanted to do something, kasi nanay siya, it's her responsibility sa anak niya, pinilit niya. Napilit yung anak to go to the dentist. Dito nga, umupo sa chair even, pero umiiyak yung bata. All the while na nandito yung bata, iyak siya ng iyak. So, fino-force, sino-open yung bibig, ganun. This dentist of ours, di ko na lang papangalan, pero dito sa clinic, our associate dentist, alam mo yung ginawa niya? Of course, she checked. At least meron siyang ma-relay na information sa mother. But this doctor did not proceed. This doctor said, ma'am, I know you wanted to really have your child treated, but I cannot move forward with the treatment, seeing and feeling the pain of the child. Ang ginawa ni Doc, i-introduce na yung mga instruments. So this is the explorer, this is the mouth mirror. Kumbaga, that certain visit was an introduction. Ito yung, hello, dito yung dental clinic, I am your doctor, hindi ako nakakatakot na person, I will help you, and visit next time, but for now, this is the clinic, ayan, ito siya, there's nothing scary about being here, and ititreat ka. So, hindi niya talaga pinilit. I like that thought, na hindi niya pinilit yung bata. Kasi ang dali lang naman pilitin, pabunga nga, hawakan. So, sinabi rin ng mother yun, hindi, andito na kami, sayang yung pagpunta. But
that's actually the thing I mean, hindi siya ideal because sometimes yung parents, like victorious ka nga na nagpa-treat yung bata, pero hindi na uulit yan.
Yeah, okay.
Hindi na uulit yan. Kasi because of that trauma. And dadalhin niya yan hanggang mag-adult na siya. So, dahan-dahan, be patient with your kid.
Yeah.
Kasi at the end of the day, it's a long process we have to save the teeth as long as we live. So, parang yun yung pinaka-ideal why we're here. But if you put some trauma of because of the procedure, hindi na gugustuhin ng bata bumalik sa dentist. So, kahit anong gawin mo, anong pilit mo, syempre pag adult, di mo na mapipilit yan. So, doon nagkakaroon ng problem. So, be patient with your kid.
Yun. Correct. So, yun, wala. Si dentist, naging parang playtime lang, introduction of...
Which is good.
Walang nangyari. And you know what? After a month, bumalik si mother with the kid. The kid was na, ito pala, di umalis, binigyan ng chocolate. Parang, here's your prize for visiting the dentist even though walang procedure.
Okay.
Kasi we have chocolates here naman. Pwede naman yun, kakain ka ng chocolate, toothbrush ka lang. Anyway, so bumalik na siya after a month. Hindi siya umiyak.
Nice.
Hindi na siya umiyak, nagpa-cleaning siya. Hindi ata nagpapasta pa. But one step at a time. And this kid, lumaki na siya dito sa atin. Grabe naman yung lumaki. Siguro parang 4 years. 3 years old siya noon, pumunta. Every year pumupunta. 7 years old na siya ngayon. Nakakatuwa. So, ako rin, no? Parang natutuwa ako na, this is how you treat your patients. Adult man yan, kid man yan. Do not put pressure.
Yeah.
Do not parang force. Because it will create trauma, it will create pain sa heart.
Exactly.
Na aayawin na nila mag-visit sa dentist. So, ganun din pala yung responsibility ng dentist, no?
Yeah.
Not just na, okay, i-treat natin yan. No, you have to also feel your patient.
Actually.
May dental psychology ba, Doc Jonas? I mean,
Usually,
part ba yan siya ng...
Yeah, actually, yeah.
Okay.
usually kasi in-incorporate yan sa dental school, how we manage the patient. Even with sa Germany, with the masters, ang daming dalawang semester yan na patient management, psychology talaga. That's very important kasi associated kasi palagi ang dentistry and pain. So how can we manage the patient by, learning psychology? I mean, yeah. Kasi hindi kami yung parang robot na nakaka-feel kami. Like if you have trauma, tapos nasa chair ka, tapos ang dami mong ah, parang alam namin hindi ka comfortable. Kami mismo actually affected din kasi we want you to be as comfortable as you can kasi procedure yan
Okay. Buti na lang you mentioned that, Doc Jonas, no? Ito yung second question ko sa'yo. Do you get affected when patients pose or say they are scared of the dentist? So you mentioned, yes, you are affected. So, yung answer mo is yes. But how? How are you affected by these traumatized patients?
Well,
Pero nakaupo na, no?
usually kasi it really depends on the procedure.
Okay.
Let's say for example, it really depends on the procedure. Let's say for example, the procedure is kind of invasive and it's very technique sensitive. So if the patient is having difficulty in the chair,
Mhm.
tapos ako grabe yung focus ko doon, I'm the type of person who parang mini-make sure ko na comfortable yung patient. Kasi at the end of the day, magkakaroon tayo ng problem doon with the during the procedure. Baka may ma-miss tayo kasi pwede siyang gumalaw na affected yung isolation, something like that. Pwede natin ma-hit yung mga dapat hindi ma-hit. Kasi siya conscious yung patient, di naman siya under general anesthesia or nakasedate.
So you mean,
So we need to be more cautious. That's why affected talaga ako. I mean, that's my personal experience.
yes, personal.
Hindi na well, did you know that whenever a dentist, according to our research
Okay.
whenever we administer anesthesia, yung BP namin nagre-raise ng 20 points. So we have
Dentista mismo.
ang dentista mismo. Because there's a risk. Like, hindi naman kami yung parang walk in the park whenever we administer anesthesia because you're hitting possible nerves in there. Kailangan namin maging cautious. Baka if the patient moves, pwede magkaroon ng problem, mabalian ng needle or ma-hit yung nerve. So, nagkakaroon kami na that's normal to a dentist na nagkakaroon ng talaga ng elevation ng BP namin. Kaya the more na madami kang ina-anesthesiahan, 'di ba? So medyo hindi siya healthy for us also. And we want
High blood pala.
high blood ang labas. Kaya tumataas yung cortisol level namin, ang taas. Na after the procedure, akala nyo kayo lang. Akala ng patient sila lang. Kami also dentist, especially like sobrang focus ka, like you're into the procedure itself. Gusto mo, you want it done perfectly. Nandun talaga yung stress, cortisol level tumataas.
Okay, so Doc Jonas, meron pa akong na-research. One of the reasons why patients get trauma or get dental anxiety is because of judgment by other people, other dentists to be exact. So maybe ang understanding ko here is when a certain patient goes to a dentist, so papacheck nila, what they get is parang shaming. So chinek, this certain doctor, bakit ngayon ka lang? Ano ba yan? Lumala na. Napapagsabihan or napapahiya na these patients get embarrassed because shocks. Nga no, I did not take care of my teeth for too long, pero nahiya na sila. Pinagalitan ng dentist. they feel bad now after going to the dentist instead of parang, okay, this is my time for me to get treatment,
Parang to be encouraged ba?
to be encouraged. Ang nangyari, napahiya pa sila.
Mhm.
So, na-trauma na sila kasi ay, ayoko na lang pumunta sa dentist kasi pinapagalitan pa ako. Something like that. Is it true? May ganyan ba talaga?
Well, there's certain culture like that sa mga dental clinics, no? Pero syempre, I cannot speak for them. Because it's not true here in our practice.
Yun nga eh. That's why nung na-research ko siya, parang, may ganito pala.
Mhm.
Because our doctors, ikaw hindi ka ganyan, I've seen you. Our doctors here, when I go inside the treatment room, walang ganyan eh.
Kasi at the end of the day, you're here, we are here, God put us here to help these people.
Mhm.
I mean, we don't need to, parang we have to educate them.
Mm.
We have
Of
to
course.
tell them what's wrong
Mhm.
in a way that it's not embarrassing.
Okay. Yeah.
And
Yeah.
also, we have to help them. Kasi at the end of the day, you have to help them eh. Yun naman yung goal natin. If we cannot help them, so what's the point of us telling them what's wrong kung di ko naman kaya silang tulungan? Pero, hindi siya dapat ganon yung approach sa isang patient. Kasi it takes courage for them to visit a dental clinic if ganun na yung problem.
Mhm.
Kasi nga, takot nga sila eh. So, na-judge pa. So, doble-doble. So, babalik pa ba sila? That's the question.
Doc Jonas, can you kindly share or do you have any tips or advice for patients having these kinds of anxieties or fears?
Well, number one, you have to look for a dental clinic na reputable, of course, and then establish a relationship with them. I mean, a patient and dentist relationship.
Trust, rapport building, like you mentioned
Yeah.
earlier.
That's number one. Number two, dahan-dahan. You go for minimally invasive procedure. Don't go straight to surgery if di mo pa kailangan. And then discuss everything with your dentist. Be transparent sa lahat-lahat ng mga concerns mo, anxieties and everything, para at least they know how to deal with your problem. Kasi at the end of the day, we cannot deal the problem in the mouth if ang wall mo psychologically sobrang thick. So we have to deal with it first. So doon papasok yung rapport at saka trust ng patient and dentist. Syempre kailangan maging open din sila sa mga possibilities na anong sasabihin sa kanila ng dentist, because there are also cases like if it's very very parang end stage na yung ngipin na yon, it has to be, kailangan na siyang tanggalin. So magiging transparent naman yung dentist kasi usually that's the approach eh. Pero mas maganda if dapat open kayo sa isa't isa. And open ka sa dentist mo, and then your dentist should know yung struggle mo, not just dental but also your trauma.
To add, no, Doc Jonas, you mentioned earlier about developing yung mga trauma, childhood pa lang, dyan na de-develop, nagsa-start. I also said that ako mismo, I had fears sa dentist, doctors in general, when I was a kid. Akong nare-recall ko talaga, and I'm very thankful sa parents ko because talagang pinush nila ako na twice a year, kahit na natakot ako, they always push me and enlighten me. Ano ba yung importance of having your teeth checked, teeth cleaned? Na sinabi nila sa akin, if we will not act on that nung bata pa ako, what will happen in the next years to come? Baka pumangit ngipin ko, it will affect my health, and so on and so forth, na parang magiging very bad siya, na it will affect my whole being. I had this fear as a kid, pero na-develop ko yung courage ako mismo because my parents were there. Wala naman palang kailangan katakutan because it's just a simple cleaning. Okay, may mga napastahan ako, pero it wasn't really scary. So, na-develop ko din siya over time. So, well, what I'm trying to say is, parents who are watching or listening, please have that responsibility in yourself to develop that courage in your children. Encourage them. Doctors, dentists, friendly yan. Friendly sila. Do not use them na, oh, pupunta ko, papagalitan ko ng dentista. No, that's not the right way. You say, heroes. Heroes yung doctors. They will save you. They will be there to protect you. And kung may mga problem, they will save you. So, that's the role of parents naman sa health, oral health.
Usually, di ba before, na remember mo, na may mga kids akong pinupuntahan to educate the parents and the kids.
Oh, yeah.
Yung mission.
Yeah, yes.
Dati kasi yun, every 6 months.
Yearly.
6 months. 6 months.
Every 6 months. Okay.
Pumunta ako sa school.
Pre-pandemic yan.
Pre-pandemic, oo. Pumunta ako sa school, educate the kids and the parents. Palagi ko sinasabi sa parents na it is your responsibility to educate your kids, and yung ngipin nila, responsibility niyo yun. Kasi bata yun eh. Kasi palagi ko naririnig sa parents, yung anak ko kasi hindi nagtutoothbrush, malamang 4 years old pa lang yung anak mo. Hindi talaga magtutoothbrush yun. It is your responsibility to guide them to brush your teeth properly, to avoid these problems. Kasi once you have infection in the mouth, yung sa ngipin, pag bata pa lang, it will actually show doon sa final, sa permanent teeth. Nagkakaroon ng like mga stains na associated doon sa infection of the deciduous tooth, yung milk tooth. Kaya nagkakaroon talaga ng effect yun. And we have to preserve yung batang ngipin sa, may mga timing yan kung kailan siya bubunutin. So, hindi siya basta-basta, kasi bata pa, babayaan nyo na. Parang something like that. So, I always educate the parents to be responsible and teach your kids. Hindi yung pinapasa nyo yung responsibility sa bata na ganyan pa kabata. Kasi hindi talaga kaya ng bata yon. Kasi bata eh. That's why we're here to guide them. Yun, pero ideally, ganun talaga dapat. Pero syempre, there are reasons sometimes na hindi ko alam kung bakit nagkaganon. That's why I don't blame them. Pero don't blame the kids. Kasi kids sila eh.
As a mother, sometimes our son Silver tinatamad mag-toothbrush. So I guide, like what you said, I educate. In YouTube, mayroong mga videos that will help them na ma-encourage sila to brush their teeth. So pwede yan. Advent of social media, videos, kung ano-anong mga apps that can also help you. Diba? Kung tinatamad si baby, be creative on how to guide your kid.
Tama.
Kasi nga, like what you said, it's the responsibility of the parent.
At saka nowadays kasi it's an investment eh. Like your teeth is an investment. Like it's not as before na parang hayaan na lang. So dapat you have to invest bata pa lang, no?
Doc Jonas, I have a question again. Dami natin questions. So of course nga, traumatized si patient. For a very long time, he never visited the dentist. So, certain period, pumunta na siya. But, takot pa rin. Mag-a-ask siya, is there any alternative sa dental procedure? Kaya, okay, this patient went to the clinic, we took x-ray, we said, may infection. So, there are two dental treatments possible. Root canal or extraction. Okay? So, mamimili na lang of course, we will recommend, but at the end of the day, nasa sa patient yan. Budget-wise, ano yung kaya ng mental health niya, root canal ba or extraction. But, there are cases, i-ask the patient, are there any other alternatives? Paano yung ganon? Meron bang mga other alternative procedures for that?
Well, albularyo, gano'n. Well, wala.
Okay.
Wala. Pag ganon, kasi if there's an infection, and then you just parang neglect the treatment for that certain tooth, then the infection will not stop. It will grow bigger, and it will affect other teeth, and it will affect the system itself. Ang daming associated yan kasi pag may infection, lahat yan kumakalat sa buong katawan.
Okay.
Not just the teeth, hindi siya localized lang. There are certain, may boxer pala, sino nga itong boxer na to na flyweight boxer siya na namatay siya. Pero it was like 100 years ago. Namatay, Filipino boxer, namatay siya because of the dental infection. Yes. Sikat siya, si Pancho Villa. Something like
that. I-research natin.
I-research nyo. Flyweight champ siya ng Pinoy. Kinamatay niya dental infection.
Ay.
Yeah. Kasi wala pang treatment before, like 100 years ago. 1920. Yeah, 100 years ago. Wala pa masyadong treatment, wala pang antibiotics. So, the innovation in dentistry, hindi siya dapat dinineglect kasi we've done lots of research dito sa profession na to to save people.
So, Doc Jonas, no any other alternative procedures?
Nope.
No amount of medicine can treat. Example nga, dental infection, no?
Nope.
Nothing.
Nope. Yeah,
albularyo, wala. Even prayers cannot help the infection.
Nope. You pray that
get eliminated.
Pwede ka mag-pray to find a good dentist, and God will give you the wisdom and point you to that person to have a no trauma or a traumatic procedure to get rid of the infection. Kasi that's actually that's why we're here. God placed us here. I mean, God made this profession to help people. It's not an accident.
Okay. So, ipasok natin sa field of cosmetic dentistry or restorative and cosmetic dentistry, yung sa specialization mo. How do you deal with patients wanting to get veneers, yung mga restoration, but they are traumatized, or alam mo yun, they want to get veneers, but how will they be able to face hours of sitting down on your chair?
Well, usually
dito na sila sa clinic, yun nga lang parang it's a battle. Papagawa ba ako? Natatakot ako. Doc, help me.
Actually, yung question na yan minsan, they have to think if they really want it.
Okay.
Kasi if they need it, but if they don't want it, minsan yung mga tao ngayon, it's want-based na, not need-based eh. If they want it because of the social pressure, hindi na sila makangiti.
Okay.
I mean, that's actually one of the reasons bakit nagpapaveneer yung tao, because they're actually traumatized na palagi silang sinasabihan na, or palagi nababati yung ngipin nila. Tapos alam nilang hindi maganda.
They're also bullied.
Bullied, yeah.
Kita mo yan, marami nagko-comment sa social media natin. They say that pangit yung smile ko, napupuli ako.
Yeah.
It's not my own words. You can search it talaga sa comments.
Actually, ang daming nagme-message. Ang daming nagme-message sa akin personally at saka sa page natin about their struggle na paano sila nabully nung bata pa sila, and then up until now. So sometimes dun sila kumukuha ng lakas. And my responsibility is to do the procedure as fast as I can, fast and efficient, and dapat hindi siya traumatic sa patient. That's why, we keep on honing skills so that mas effective tayo. Pero at the end of the day, it can yung willingness talaga ng patient, kasi doon na yun pumapasok eh. Pero pag, let's say for example, if you're not ready, don't do it yet kasi di ka pa ready eh. So you have to find that courage muna kung saan man siya hanapin mo, and dahan-dahan ka, pag clean, dahan-dahan. Don't go straight to like the procedure that would change everything tapos hindi mo na mababalik. So, sometimes also when it comes to cosmetic, no, ang daming pumupunta na trauma sila because of the cosmetic procedure.
From another
Yeah,
dental clinic.
from another dental clinic. Nagkakaroon ng problem. So, alam mo yon, ang trauma minsan nandun din. So, yung trust nila sa dentist, pupunta kami sa dentist, sisirain na naman yung ngipin. Trauma yon. Na-trauma yon.
Yeah.
Same cosmetic dentist din naman siya. So, bakit ganun yung nangyari? So, pero, syempre, iba-iba naman yung dentist at the end of the day. We have different trainings, different levels of, yung sa lahat. Different.
Another angle yun So, we've been talking about childhood, yung embarrassment, pag pumunta sa dentist. Itong sinasabi mo, another angle. Wala siyang trauma going to the dentist ever since.
Na-remember mo to? Sorry, kakat kita.
Sige.
Kasi sinabi mo, na-remember mo yung isang patient natin na nasa brink na siya of anxiety na sabi niya, we saved her.
Uy, ang dami.
Ang dami nga pala. Pero ito isa, kasi kakabalik niya like after a year. Kasi
Pero seriously, ang dami.
Ang dami.
Yung sabi mong sleeve na, ang dami yan.
Kasi nagkaroon siya ng veneers before, tapos nagkaroon ng gum problem, tapos sumakit na infection.
Yes.
So we did a lot. Like we did we established the health, established the functionality, the function, aesthetics.
Yeah.
Madami kasing patients na consistent naman sila.
Yes.
Bata pa lang nagpapadentist.
And happy sila.
Pero cosmetic-wise, pumunta sila sa cosmetic dentist, nagkaroon ng problem, nawala na yung trust nila sa isang dentist or any procedure. Hindi lang siya associated palagi sa pagkabata.
Yes.
Pwede siya yung current.
Yes. So yun, actually, you mentioned consistent siya. In fact, marami tayong patients, they always say, ang ganda nga anong ngipin ko. Paragi akong pupunta sa dentist, bata pa lang, toothbrush ako, floss, mouthwash, taking care of her oral health, as in, grabe. But, she got veneers, walang problema.
Nauso kasi.
Ang pangit ng veneers. I mean, sasabihin nila yun, pangit yung pagkagawa sa kanila. Na-trauma sila. Because, nagpa-veneers para gumanda, but the result, opposite. It wasn't to their advantage. Di sila naging comfortable, na-bulkyhan sila sa smile, so na-trauma na sila.
Correct.
Because of the procedure they had from another clinic.
Pero ganito kasi yan, sometimes kasi we have to gauge
case to case.
Yeah, case to case. That's why a lot of dentists nowadays, doing a lot of veneers, ganito, ganyan. Pero iba pa rin yung natural teeth. That's why nauso yung minimally invasive, hindi masyadong nagbabawas. But sometimes mas prone yun sa chipping, mas prone sa tanggal because wala masyadong retention and everything. Pero yun yung mas better to, be able to save sound structure of the tooth. Pero nandun nga yung innovation ngayon in dentistry that we are trying to create a biomimetic approach when it comes to restoration and also aesthetic outcome. So that's why, yeah.
So for this angle, there's a really big responsibility coming from the dentist taking care of patients.
Exactly.
Whether may trauma sila before or whether they've been responsible enough to visit the dentist since they were a child, still the responsibility of the dentist to take care of their patients.
Yep.
Talaga.
Yun.
Doing the right treatment.
Correct.
Yung trust is always there.
Yep. And it's not about like after doing the treatment, bye-bye na. Kasi tapos na eh. It's actually once you touch the teeth of the patient because the patient allowed you to do her teeth, do something about it. So it is your responsibility kasi ikaw yung may gawa nun eh. So dapat be responsible enough to take care of the patient. Okay? So kaya dapat hindi siya yung parang one-time thing lang. After everything, okay, bye-bye na. So dapat hindi. You have to keep the patient. Kasi you know the history, you have the record, everything. So dapat ganun.
Okay, so Doc Jonas, I think we've covered much about the topic about dental anxiety and fears, getting dental procedures. So, to close, do you have any last words or any key takeaways you would want to share to our audience?
Well, to combat anxiety, dental anxiety, you have to uh, find a reputable dental clinic, and also you have to be open and transparent when it comes to your trauma sa dentista, and also step by step procedure. Kailangan malaman nyo ano yung atake from start. I mean the case itself, check-up, assessment, and then may roadmap dapat kayo when it comes to the procedure, kung ano man yan. Kasi sometimes, kung matagal na kayong hindi nakapunta sa dentist, ang daming issues. So, dahan-dahanin natin from cleaning to pasta to root canal or surgery or whatever to braces or whatever. So, your dentist will give you a treatment plan suitable for you. So, assessment is very important. So, dahan-dahan yon. And also, wag kayong mahiya to tell to tell the dentist yung struggle nyo. And then, kasi kami,
Be open.
be open. We also have struggles also when it comes to treating the patient who has anxiety sa chair. Kasi we care. I personally care about the patient's welfare. Kung ano nafe-feel niya, nafe-feel ko din. Kaya lahat ng galaw, pag nasa chair ko, lahat ng movement niya, basang-basa ko. The movement of the finger, movement of lahat, eyes, pati yung paa, ninonote ko lahat yan. Kasi pag may mga uncomfortable situation, nag-stop talaga ako and I ask the patient. Kasi ang hirap na matapos yung procedure, traumatize yung patient. Kasi we want to help the patient at the end of the day. Yung hindi tayo dapat just to complete the treatment tapos nababay na. Hindi. We want to take care of you. That's really what we do here in our clinic.
And lastly, this is generally speaking, yeah, of course, it's focused on dentistry, but generally speaking, we, as a person, people, we need to overcome our fears. Because sometimes if we are boxed with our fears, we cannot move forward. So you want to improve, you want to be a better person, but you are imprisoned with your fear, walang mangyayari sa'yo. You cannot grow, you cannot achieve the full potential that yung binigay sa'yo ni Lord because natatakot ka. So, I guess the first step is to open up yourself, say, yes, I can face my fear, and do it. Because at the end of the day, it's for me. It's for you. If you will always have that fear inside of you, then nothing will happen. Specifically on dentistry, you feel pain. You are scared of going to the dentist. Okay, I will just bear with the pain, drink pain meds. Kawawa yung liver mo. Kawawa ka, you cannot work well. Kasi may pain, your body, hindi ka makatulog. Then your body will deteriorate. So it's not for the dentist. It's not for anybody else but you. So really, overcome your fear. And you will have a better life.
Yeah, I mean, we cannot help you if you cannot help yourself.
Yes.
We're here. We're just here.
And that's it for today's episode. Thank you all for tuning in. And We will have more episodes to come. If you have any comments or suggestions, you can message us on our social media accounts. Thank you.
Thank you. Bye.